Healthcare, sadly, has become the #1 driver of poverty, homelessness, and bankruptcy.
You've got people trying to make decisions between buying health care or groceries.
2 out of 3 American working people are denying themselves of care because of the out-of-pocket costs. Farmers, the truck drivers, the manufacturers, the distributors, the county governments, the school districts, they're the ones suffering the most.
It's shameful.
The people prescribing health care don't understand what it costs, and employers don't think that there's anything that they can do about it.
All the solutions to fix healthcare have already been invented, they've been proven, and they've been replicated. #1, the government needs to make sure that the law on hospital pricing transparency is enforced.
A transparent, better care, lower cost, more control health plan. That's what we're doing.
I mean providers that are unafraid to be judged on quality, and they're unafraid to post fair, reasonable price up front. And so we've built health plans that incentivize members to go to those types of providers by completely waiving any out-of-pocket. So now we can get members to a $700 MRI instead of a $7,000 MRI, and the employer pays 100% of $700 instead of 50% of $7,000.
I was recruited by the state of Montana to take over the state employee health plan with the sole goal of turning it around financially. Saved $121 million, and how we did it was putting in the reference-based pricing contracts from the hospitals, changing the pharmacy benefit. We enhanced primary care. We managed it, and they got pay raises. We didn't need any legislation to do what we did. We just went out and contracted with the right parties. There's nothing to stop any public employee health plan from doing this.
Ashtabula Area City Schools is the 8th poorest school district in the state of Ohio, and union leaders started to nod their head and say, yes, absolutely, we want better benefits and 0 deductibles, 0 coinsurance. The plan got better, a direct primary care doctor, a community pharmacy. We took back health care, over $2.4 million in savings in the very first year.
Our first year in, we saved $780,000. $780,000 in Barberville, Kentucky, that's the equivalent of another small town within the town.
We saved the district and its employees. 2021 was $2.5 million. And somebody in the audience said, we closed a school this year. That $1.5 million would have kept that school in our district open.
In Osceola County, Florida, they've saved $30 million in 2 years.
We have a large Taft-Hartley firm that we actually saved $31 million in 1 year.
So the city of Milwaukee was able to save $37 million in 1 year. They were able to avoid layoffs as well as lower the deductibles and co-pays from $4,000 per family to $0 per family.
We reduced their cost of prescription drugs by over $10 million. I've got the data, I've got the examples. Show me where I'm wrong.
Our direct contracts are so significantly lower than the status quo BUCA plans. It enables a plan to offer all of these care benefits at 0 out-of-pocket to working people. Generics for 0 out-of-pocket, surgeries for 0 out-of-pocket, imaging for 0 out-of-pocket.
We're able to take that money and redeploy it within the company, whether it's more benefits, more 401k, more wages, less money out of their paycheck, less money out of their pocket, enhanced mental health benefits, enhanced physical therapy benefits.
We've put more than $5,000 per employee back in their pocket that is reinvested into retirement or into their take-home pay for the betterment and quality of life, and that has resulted in extremely high retention rates.
This model works everywhere.
The union was phenomenal. We couldn't have done it without them. They became the biggest advocates. They wrote opinion pieces in newspapers.
The unions, they love it because they can add real take-home value to their members. And then the community loves it because they're not being asked to dig into their pocket one more time to pay more in taxes.
If every employer did what the employers we're working with did, that would be like a $500 billion recurring stimulus every year.
In the inflationary market that we're in today, I can't think of a better way to offset that than taking any entity's second or third biggest line item and cutting it in half.
Healthcare can be done affordably for the working middle class.
America already has the solution. We just need to scale it.
This system is fixable.